So it is 7:31 on, gosh, I don't even know the date, April 21st. The Board of Health, and we'll call our meeting to order. First, we have last meeting's meeting minutes from February. So I have a motion to accept those.
Motion to accept.
Is there a second?
Second.
All right. Any opposed? All right. Hearing none, the minutes pass. And we'll move on to our reports. Sam, you're up first.
Sure. So we'll do a quick overview of things going on in terms of respiratory viruses in Connecticut. Like everything, flu, COVID, and RSV are all going down. If they're not at background levels already, they're pretty darn close to that. And so that's a good thing to see. In terms of H5N1 bird flu, still no cases in Connecticut. There's about 1,000 herds or so that have been impacted, countless birds, 17 different states. We've had 70 human cases and 1 death, and of those 70 cases, only 3 have sort of unknown origin. So most are associated with dairy, poultry, or other animals, and then 3 of unknown origin. But it's slowing down considerably, which is a good thing. And some of the theories as to why that the CDC is proposing is that it's kind of run through all the population that it can run through at this point, and so it's not getting a foothold. That there's some better screening of dairy products that are catching things a little earlier. But they're really saying, well, it's kind of worked its way through the population and it's going to work its way through here. Regarding the national outbreak of measles going on, so we're up to 839 cases. 709 of those are in the sort of Texas cluster of New Mexico, Oklahoma, Kansas, and Texas. That's 709 of the cases. There are 8 states that are impacted with outbreaks, and then another 5 states impacted with single cases. We don't have any cases in Connecticut yet, which is great. And again, they're saying generally the overall risk is very low still, especially given the high vaccination rates that Connecticut has. So we did complete, and just that, the thing that a lot of them don't mention is that Canada is also having a outbreak of measles with over 1,000 cases there, and Mexico has 450 plus cases across the border from Texas. So Canada, they say it's the same community that is impacted in Canada as is in Texas, and so a highly unvaccinated population. But again, risk remains low. We completed our spontaneous responder training series, the first one that we did. We had the Hub, which is a regional substance abuse prevention group, conduct a naloxone training, and that there was 26 people attended that one. We did a hands-only CPR, AED, and stop the bleed combo course. We did 2 sessions of that, and we had 35 participants in that back in late February. A month later, we had Question, Persuade, Refer training that Santina and our nurse, Julie McCullough, it's not McCullough.
That's right.
McCullough. For some reason conflating a different name in my head. But conducted that. They had 13 attendees from there, and we've had, I think it's a third request. We've had 2 requests already from Sacred Heart University to come and deliver delivered it once to a sorority.
Yes.
The most recent one was to, I'm trying to remember, it was like a service club or something like that.
Yeah.
Like a club. And then they were asked back to come and do another one. So they're, feeling like they're finding interested parties and continuing to do that. So we're happy about that. But we'll continue to do that. We're going to do a seizure awareness program is one of the next ones. One of the participants said, hey, I was recently diagnosed with this, and I kind of did this for my office staff around here, and there's these training programs out there, so we're going to kind of promote that around, and we will keep adding the courses. We're going to do a full CPR, adult pediatric one, and the hub that conducted the training, and it was it was open to anybody. So we really don't know of the 26 participants. A lot of them were wearing MRC or CERT paraphernalia, so we thought, okay, well, we'll take credit for some of them, but they offered to do one just for us. So we will probably do that again in the next couple months, where it'll be just those that we recruited.
I think it's the answer I was going to ask. What is the primary audience of these participants? But it sounds like MRC CERT is part of it, but who's doing like the hands-only CPR and stop the bleed? Like, where are these folks being gathered from? So, are they kind of like already a group coming together, or are they just really random people from around town?
It's a little bit of everything. So we've said we don't want to restrict it to just our Medical Reserve Corps and our Community Emergency Response Team. So we've opened it up to the community in general. We've opened it up to town employees. And so we've got the buy-in from the administration to, if people want to participate on town time, they're fine with that. But again, the idea behind the Spontaneous Responder Training Series is to train anybody, such that if you're in the community and there's a need, you have some skill, that can be of assistance to someone in crisis. So that's the point. And so we'll continue to do it that way. We don't restrict it in any way.
Are the times going to be varied a little bit so that you might gather different groups of people, evenings versus business hours?
We did, the hands-only CPR Stop the Bleed AED training we had a 2 o'clock session and a 6 o'clock session, and then the QPR training was in the evening, and the naloxone was online, but it was during the day. So they have different sessions that we'll set up, and so we may want to do the next one in the evening. So
well, maybe targeting some of the like the Little League and basketball, soccer, like those families groups, et cetera, and might be a good population to grab.
Yeah.
If something goes wrong there, like it's tragic, and having someone there that can respond is often life-saving,
Yeah. No, I agree, and that's the intent is to we'll keep offering programs and see if something works better than others, and we'll focus on that, and kind of like we're doing with the QPR, we'll try to saturate that group that's interested, and try to find populations. It worked with our Matter of Balance program. We've offered it, then we train people, and then they offer it, and so it's this exponential effect where there's dozens and dozens and dozens of Matter of Balance courses because we've been offering it for 11 years now, I think. So, but anyway, so that was that training series. I did have the opportunity to do the psychological first aid training program for the Community Emergency Response Team back in March 1st. They have an annual class where it's over a couple weekends. They have a new member training. So they're up a little over 100 members now in the Community Emergency Response Team, and they're very active. And we try to support them in every way we can. They came and borrowed our radios the other weekend for, I forget what event it was, the Bunny.
Oh, the
5K
for Park and Rec.
Yeah, so we try to support them with, our equipment and things like that, and time and money as well. And speaking of money, we did present our budget. As I explained before, no major changes, going on, moving a few things around here and there, but nothing significant, no new positions or anything like that. We presented to the Board of Selectmen, they approved it, the Board of Finance, they approved it, now it's at the RTM, and we've presented to the RTM, and we'll have the final vote in early May. And, I've had no comments or questions or anything like that, and Tina actually did the RTM presentation, and she did a good job, so she wanted the chance to try it, so we gave her a chance. I mean, obviously it wasn't as good as mine, but, it's learning. So I did get, in mid-March, a subpoena to appear in Superior Court. This is related to a housing case, for which I had absolutely nothing to do with. Former retired employee, and so they subpoenaed me. And so I sat in court for a couple hours and then answered, 3 minutes of questions, of which a lot of it was like, I've never been in the house. Never seen any of it, tried to explain to them, but, they often do that. We'll subpoena lots of people related to these. So, we did have also have the United Illuminating will come once a year and do what's called a storm prep meeting to kind of go through, as we approach hurricane season, sort of their strategies. And so the town has different priority lists, and they have priority lists for them as a utility. And so they kind of talk about that. They kind of talk about how it will currently work in terms of make safe crews initially, and then retransitioning those people back into repair crews, and focusing on sort of high, repairs that will benefit the most customers at once. They did say, and I think I shared this last fall maybe, that the situation with natural gas hasn't changed at all. And so, we're fortunate this winter we didn't have any really long extended cold snaps where they've essentially said that we'll have some potentially some brownouts, but they said in terms of nothing's really changed in terms of the supply situation, so that during the peak of the summer we could experience the same kind of situation with rolling brownouts, rolling blackouts, excuse me. But it's good to meet with them, kind of get to know the people that, when a emergency operations center is set up, these are the people that will be in the room and have access to the sort of updates from UI more efficiently. So on the 20th...
I have a question.
Sure.
When you all stand up in EOC, is it here in Independence Hall, or where?
Typically, it depends on the scale and the size and the location of the emergency, but typically it's the police station has a second floor large classroom where we set up there, and and they have a couple different areas to break out. So that's typically where we've been for the large scale ones. The police just did submit a grant to update that space to make it more technologically efficient to provide that service. So hopefully we'll see. It's one of those congressionally directed spending opportunities. So you make your pitch to Senator Hines and see how that goes. We did support a letter of support to the police department's application to that. But yeah, most of the time at the police station, and then occasionally we'll go other locations or have like the PIO group might meet on their own somewhere else and work on messaging, and then like at the conference room next to the selectmen, so they're getting a ready message to go out, that kind of situation. On the 26th of March, the Department of Public Health at the state informed us that they received notification from CDC that 2 of the grants that we have would be impacted, and that on the 26th that all expenses had to cease on the 24th. So we had met, and I think I might have shared, we met with the finance director and others here to sort of lay out what would happen, and we suggested a couple different approaches to how to handle it, and so we have implemented one of those. They did put a stay on it, and so they offered an opportunity for additional expenses to be charged, but we're still waiting to see on the final result of that, funding. I think they call it a clawback.
Mm-hmm.
And so we're waiting to see that. But basically, one of the staff on the grants had already moved off to a town position to be a part-time nurse, and so we kept she was on the immunization grant, and so we only had one other part-timer on the immunization grant, and so we've just decided to keep her. She's doing vaccination work, so we're funding her through our seasonal flu account. And then the other individual on the ELC2 grant, which was the other one that was ended, we have another grant, the Workforce Development Grant, that we are going to switch her to. We've kind of made an agreement with the town to keep them on the seasonal flu until we figure out what all the court hearings and everything say, and if it's goes in our favor, then we can just sort of journal entry all those expenses back to the grants and try to spend down some of the grant funds before we go into the grant funds that we have that are we haven't tapped into yet. That's our Workforce Development Grant, where they feel like they won't be able to pull that back because the state has actually dispersed it all to the individual towns. So we have the full funds and we haven't tapped into it yet. So we have that. That's where we'll switch one of the staff over to when the time is right. In terms of preparedness, we've conducted a series of call down exercises recently. I don't know if some of you may have gotten the calls, some not. But we're kind of re-familiarizing ourselves with the Everbridge system and updating the lists and contacts, and so we'll be doing that for the Medical Reserve Corps as well. We did send out a volunteer opportunity for an event. I'll let Sarah talk about it, but we have 9 volunteers from our Medical Reserve Corps that are going to be doing this cardiac screening event that Sarah will share about. She's done all the work on it. I'm not trying to take credit, not like I usually do. And this week, Wednesday, we'll have a call center setup training. So we created and we maintain, along with support from the IT department, the town call center. And so we have basically a large rolling bag filled with phones and splitters and all those kinds of things, and so we can set up in here or anywhere. We've tested in different locations around town, both the schools and town buildings, at the senior center and our offices over at Public Health Nursing, in this room several times. We brought down the entire phone system at the senior center one time with that, and so we learned that we have to train it, check it every now and then, and update the phones. But we'll be doing that this week, 2 sessions for our staff to learn, just what it takes to set up the phone center. Most of them have done it, but we've had a few new staff over the last couple of years that we feel like should be familiar with that. We did have on the 6th of April, one of our clerical staff, Chelsea, left us for a new position. We're happy for her, but leaves us with a part-time afternoon clerical position that we want to fill, so that's currently posted. We did get a series of complaints regarding a number of issues down at Fairfield Beach Road. While several of them we didn't find enough to take action, one of them we did and issued an order related to overcrowding, and so we're working with the owner, met with the owner to try and resolve that. It's very late in the year to try and resolve that kind of situation where they'll really only be there for less than another month. So it's unlikely that we'll get to evictions, but the owner's been put on notice that the kids moved in, extra people. But we're following up with that regardless, and forwarding things where they need to go. We did, unfortunately, we did have to have a property owner arrested for health violations. They were, we applied for it, and an arrest warrant was issued last week, and on Friday, they called the individual, had them turn themselves in, so it's just come down to the police department and very civil procedure. But unfortunately, we've given the individual almost a year to address some issues related to mosquito breeding habitats and damaged fencing and debris on the property that's collecting water. And so there's several issues there, and we've been trying to get them to resolve that. But so it's come to this. So at some point in the next week or so, we'll end up in court to try to compel them to take action on this.
Sam, sorry. In several years now, I mean, I don't think I've ever heard you say that before. Like you've had to have someone arrested. I mean, how infrequently or frequently does that actually occur?
I've done it, throughout my career, probably 10, 15 times.
Yeah, it's really not much.
Like it's, more early on. I've done it a couple times a year. So what
gets you to that point, I guess, versus fines or
it depends on the code. So, for example, like violations of blight, we just implement a fine, $100 a day for every day that you don't clean up. So, we have people with hundreds of thousands of dollars of fines accrued or accruing. But in these cases where the process, so it's a criminal process. You violated a code. It goes through, what you would think of with with the courts, So often, so the first step in the process is a request for a prosecutor's, a summons for a prosecutor's hearing. So a lot of times prosecutors will call them in and have a meeting with them and say, all right, do we really have to go to the next step and have you arrested? Or, and we submitted that, and the owner is an elderly gentleman, and they decided not to do that. They just kind of went with a more civil, and they sent them a letter saying, hey, this is from the courts. We've been made aware of this. You need to comply with the letter from the Director of Health. And so they ignored that. We gave them ample time again. And so we, in talking with the housing prosecutor, we were advised this is the next step. Like, if they're not going to do anything, you have to do something to shake them up and get them there. And so a lot of times it doesn't quite get that far. I mean, it's in the last couple of years, there hasn't been many, but this one, it's unfortunate. I'm feeling like guilty about it. The police are comforting me, saying, it's okay, sometimes you need to do this to people, and I looked on the police blotter website to see, all right, when did this happen? And on that day, there's 20 other arrests, and on every day, and it's like, okay, so this is routine for them, not so much for us. So we Santina and I continue to participate in the Safe Streets Alliance. So we've had, we've come up with our name, our slogan, and now a logo has been developed by, we asked the high school sort of creative media class to come up with designs, and we selected one of those that's sort of like the leading design right now, and we're working with them to sort of finalize that. So we'll have a logo developed by the students in-house, and then the next phase is to develop a little sort of video segments for PSAs and larger presentations. We've got a volunteer videographer that's willing to step in and take care of that for us. But so Santina and I, we're almost weekly meetings now to kind of move that forward. The next phase will be reaching out for people to sponsor it, and then that will provide some seed funding for various initiatives and events and, whatever the group decides finally, different pledges and car magnets that say, certain catchy language that makes everybody think, what's that about,
Mm-hmm.
And so we're working on those issues as well. So it's a good group. Police is involved, library, us, First Select Person's office, and fire. So, and then I thought I would share. I did attach it. I'll send these down to you guys. I did attach it to the packet. So if you click on packet on the email that you got, this has been added to it. But our 2024 annual report. And so I'm not asking for approval, just handing it out to look at it. And for next month's meeting, we'll have it on the agenda for approval. If you have any suggestions or edits, comments, just feel free to email them to me or bring them to the meeting next month, and we'll go through it and make any changes or edits. I remember the last comments, I believe, Jason, you were just talking about showing more trend data. And so we tried to incorporate sort of more of that in there, multiple years of data, so people can see sort of what's going on and how at the local level, sometimes it's kind of a roller coaster ride of terms, we'll have no E. coli cases, and then we'll have 5, and then we'll have 0 again, and so the numbers are kind of, so you see a 200% increase. Well, that means we had 2 cases, of something,
Well, a really big jump in Lyme, though. Like, a legitimate jump there. I mean,
yeah. There's some.
Yeah, the winters haven't been that cold, so without the freeze, the deep freeze, it seems.
It's gonna keep.
Oh yeah, I mean, the last couple of years I've seen tick bites all throughout the winter.
Mhm.
It's been unusual.
Yeah, I saw data today that while it's still busy, we're tracking so far below last year by a bit. So hopefully this will be a little bit calmer of a year. But yeah, take a look at that, review that. It's in the packet as well electronically. And that is my report.
Great. Well, thank you. Great report. Sarah, you're up.
Okay, we had not arrested anyone. It's funny because I haven't been here in a few months, and I was like, what of all of the things that I've been juggling do I start with? And I'm going to start with staffing because we are fully staffed. It is April of the school year, so I already have some people have told me they're retiring next year, so we'll get right back into staffing. But that's definitely been a lot. I have 2 new full-time school nurses who've been hired in the last couple of months, a couple part-time people, lots of new subs. The nurses got a new contract, which was finally signed, ratified, whatever, in December, and significantly brought our rates up in line with some surrounding towns, and I've got great people applying for school nurse positions. So that has been a lucky me. I actually had more people I would have liked to have hired than I had positions, but I know I have some people retiring, so that's still coming up. But it's nice. We're fully hired, fully staffed as of right now. We have in the schools, we've had a couple of recent medical emergencies, pretty serious. It's really hard to talk about these and stay confidential, especially even just saying the names of the nurses can kind of identify the school, but in 2 separate situations, incredibly impressed by the school nurses, impressed by their reactions, quite literally saved a student's life. I'm just mentioning that because there's so much of what we do as school nurses that people think of as ice packs and Band-Aids, and then there are these things that happen, and it's wonderful that we have school nurses in every single school because things happen when you put 1,000 kids together in a building. So in both of those incidences, we've used them also as sort of reflecting and learning, incorporated them into our last staff meeting, doing some more of it with this staff meeting. Had everybody go and look at their emergency responses, which we do routinely. We have 2 emergency drills we do, but just sort of stopping and thinking, like, who are your people, and did your call system work, and how would you, communicate? And so it's been very helpful through that, but really, really proud of all three of these nurses that were involved in this and how quick they responded, and how the team worked, doing a meeting afterwards to really review what went right in all situations. I had multiple people come up to me and commend the nurses on their responses. And it's kind of a scary thing as a school nurse. You are literally the only person with medical experience in a building, and everyone's looking to you, and, you know, you can be something that you've never seen before, and here you're the leader. So just mentioning that. We have 40 nurses total that work for us across the 26 schools, and I think we have some really great people. I feel very proud of their past training and what they knew to do and how they responded in these situations. We did have 4 varicella cases in the fall. We haven't had any since then, but I think that I didn't mention it at the last meeting. So mentioning it now, worked with the state. We actually, they weren't ever considered outbreaks because of where they were and how unconnected they were, but we notified people according to what the state asked us to do. We had 2 pertussis cases last month. Also not yet an outbreak. We're still in that window where a third would be. The state has had us communicate with the unvaccinated and the immunocompromised in those situations. We're almost finishing up we've had 7 nurses precept 9 different student nurses from Sacred Heart. This is part of their public health rotation that they do. Interestingly enough, I've hired 2 of our subs who were they're young. They're like school nurses. They've been nurses for a year or 2, but they had done rotations during their nursing school experience in a school, which was enough to interest them. I mean, it used to be school nursing was, you know, you'd been a nurse for 20 years and you became a school nurse, but to have these young nurses interested in working as school nurses, in part because of one had actually did their rotation with Sacred Heart through us, the other was in Massachusetts, but they both were introduced to school nursing. So we're finishing that up with Sacred Heart. We've had 9 nursing students that 7 nurses have precepted, which has been a very strong, positive experience, I think, for both the students and then the nurses too. It's fun to go back and teach and remember, and they've come up with some great ways to sort of like use the student nurses in a way that's interesting to them and then also can be helpful to the school nurse. So that's been great. The thing Stan's had alluded to earlier, we've partnered with the In a Heartbeat organization. They do cardiac screenings for kids. They'll really do 8 to 25. The target is always that high school athlete. I've worked with this organization before in my previous job, and it was very well received and by the community, by the nurses that volunteered with it, by the parents. They do EKG screenings on students to try to pick up, or kids, to try to pick up those events that might cause sudden cardiac arrest. As Sam said, we also sent out an email. They have their own core of volunteers, and it's kind of I volunteered for them once, and then I did it a couple times after because it's just a feel-good volunteer thing. You can really use your experience and get a lot of kids through. We sent it out to the medical reserve and then also CERT and got those volunteers that Mike, the organizer, is working with to set up. We also had several school nurses sign up to volunteer and to help out at that event. We have 220 kids signed up so far, which he was pretty surprised about being a whole month to go. It's on May 20th and May 21st. There's one at Ward and one at Ludlow. FPS was super open to private school. We didn't just have to exclude it to our, to FPS students. So private school kids could sign up also. And then they also work with the Sacred Heart nursing students who volunteer there. So it's sort of circular thing. I've been working a lot on field trips. I know we're talking about that with my policy change later. I think I talked really fast, but I think those are most of my big events that have been going on. It feels like there's a lot going on. It's hard to boil it down. And we're at the end of the year part where now we're starting to look for next year already and planning some trainings and educational things coming up in the future.
Excellent, thank you.
That's great. Thank you very much.
Any more questions for either Sam or Sarah? All right. Next we have communications.
You have none?
Any from the board? No? All right. Any old business?
We have none.
Okay. That brings us to new business. Back to you.
Back to me. Field trips. Who knew I'd be such an expert? So two things in the field trip policy, which is why I brought it here. And one of them is that, and I've noticed this in I think maybe about 20 of the policies, that the policies and the procedures have been mixed together into one. And I would like to untangle them and to separate them out, in part because where the policy may not change for years, the procedure can change several times in a year. So I'm assuming that the way to do this is to sort of formally come to each of these meetings, bring those policies to you, and then suggest to you guys that I separate out the two parts. The other part that I wanted to do, the field trips, the easiest way I would say this is when I was a kid, a field trip meant the first grade class went to the aquarium. And now a field trip can mean a group of business students go to Asia for a week during April break. And what's involved and where the school nurse's role can and can't be, and that is incredibly different depending on depending on when it is, where it is, and all that sort of stuff. So one of the lines that I wanted to add to the policy, and I didn't make a bunch of copies of this, but it was emailed. You got it, okay. Was just adding, for trips occurring outside of normal school hours, the nurse cannot delegate the administration of medications. A part of me was like, is it even necessary? Because it really just becomes outside of our scope to put that in there. But I think it is important to clarify that the school nurses can still oversee, can still be a part of how is this, what's going on in the trip, how can we make a safe plan for this child with this medical condition, but we just can't legally delegate medications if we're not available to supervise. Yeah, so without some element of supervision, the delegation really can't take place. That trip, for example, that was going to Asia, we don't know the laws in Asia, we don't know what can and can't happen, what meds can and can't be brought in there, and so just really clarifying that the school nurses need to be notified and they need to be involved in the planning process for the field trips, but when it comes outside of the normal school day, it's a different kind of trip and it needs a different process.
So that was going to be my question actually when I was reading it, was just from a legal standpoint, what are state statutes? Because I didn't get a chance to really dive into that.
Yeah.
Like how does the state statute handle any of this when it's outside of school hours? I know certain things can be delegated to others, for example, like EpiPens and things like that can be, coaches and whoever's trained, et cetera. Standard medications, for anything else that aren't those sort of special things for emergencies, what does state statute say about those when it's outside of school day?
So, and you're exactly right for Connecticut. So for Connecticut, a nurse, there can be a delegation of emergency medications, and they don't specify them, but we roughly use inhalers, EpiPens, glucagon, those emergency response medications can be delegated outside of the school nurse being available at all for call. Other states don't allow that at all. And so New York and Massachusetts, for example, New York allows delegation of glucagon and EpiPen to an unlicensed personnel, meaning not a nurse, from the nurse. The nurse has to be working on call and can delegate. Massachusetts doesn't allow any unlicensed delegation. There's some of it comes down, I think, probably a bit to school nurse job protection, and if school nurses are required to be in every school like they are in Massachusetts, then they don't have as much need of a delegation. In Connecticut, they're not required, so there is a lot more ability to delegate. So some of what was happening when I first got involved in how, not so much the policy, but just how the nurses were doing it, was making sure everybody was following all these state laws. So we were sending, trips to other states that didn't necessarily meet those requirements. We were using Connecticut rules and putting them in others. So to your initial question, emergency medications where we have standing orders at the school for can be delegated outside of the nurse being available, coaches, or even a field trip that leaves at 7 a.m. and is in Connecticut, that's okay with the EpiPen. That trip goes into Massachusetts, and that's not okay. And that trip goes to Washington, D.C., which we don't have so much of, but the district I came from had a lot of. That we can't delegate to there either. And in those cases, you often do have to actually either the child has to be old enough and able to handle their own, which is easy for EpiPen, doesn't work for seizure meds, right? Can't give yourself your own seizure meds while you're in the middle of having a seizure. Or a nurse has to be hired to go with them, and then it's something additional and above, or a parent, right, if a parent's going. I met with the superintendent for Fairfield, and I've met with two of the private school principals as well, and they're super understanding when you explain it to them, like we have to draw the line somewhere, but when it comes to the school nurses and their liability and their responsibility, We really can't ask them to do all this delegating that's happening outside of the school day. But to my earlier point, I mean, there are trips happening weekends, evenings, holidays, school breaks, all those, which is great. I mean, exciting experiences for the kids, but we get into some murky waters when the nurse is sort of signing off and saying, yeah, it's okay, you can give them this medication at 9 p.m. And if they forget and they didn't give the med, or if they gave 2 of the med, and they don't have somebody to call and check in with, we need to create a different safe plan. Does that make sense?
It does, but actually it sort of brings to like my next question, which is the delegation piece of it.
Yeah.
And legalities behind that, right? Because, I mean, the nurse is carrying out an order from a prescriber.
Mm-hmm.
And so where does the authority stem from for the nurse to then further delegate that, right?
Yeah.
I think about an order that I write, in the ER, and, then my nurse is trying to delegate that to, like, one of our patient care techs.
Yeah.
Right? I mean, that would never be okay.
Right.
And then so where does that authority to delegate come from? Where is that supported in statute? I honestly don't know.
Yeah, no, so it is in there, and it's super
And
clear
I don't
for
doubt that,
Connecticut.
but, yeah.
For Connecticut, I mean, it's in every state, but for Connecticut, it's in there, and it spells out very specifically who the unlicensed personnel, and that's what they're referring. It's so funny because in schools they're called certified staff, and nurses are non-certified staff, but then the other things were licensed, and all of them are unlicensed. So it's it spells out that it could be OT, PT, speech, like who all the people can be and which medications, controlled versus non-controlled. That's where all of that comes from, but it gets into the responsibility of delegation lies still with the nurse. So even if you've delegated a medication, that responsibility is still on you, and through this process and working with the nurses, and we've had our last staff meeting, a big chunk of our next staff meeting is going to be about these. It's important just to remember that. Like if you've quickly been like, oh yeah, we have a process and we go through training and the 5 rights of medications and we sign off on it, and there's, all those steps that happen, but that responsibility is still on you, and it's a pretty heavy one it's one thing when we're in a school setting and there are things and protocols and people we call. It's another when you've gone out, to Six Flags or wherever they're going, and where is that person and where is the medicine and how are we able to get it if there was an emergency. But yeah.
And I assume those delegation statutes are written to school nursing specific areas of statutes, right?
They are. They're
Okay.
all into the Board of the state education. I have bazillions of documents because
I'm sure, yeah.
been working on these forever, and I cite them in some of them because I've found for some of the nurses to really dig in and read it is really helpful. It's like 10-212, I think it's letter G, but it spells out where you can delegate, when you can delegate, and it's all through the State Department of Education. Administration of medications in school is the big overarching policy. But yeah, just making sure that so the procedure, my procedure document is like 7 pages long now because we've been going through very specific, if it's before school, after, or after school, if it's leaving the state, if it involves these things, how does the nurse assess to say, does a nurse need to go on this trip? Does it not need to go on this trip? And it's kind of more nuanced and granular than needs to be in a policy document.
Would it be worth adding a second sentence after your first part that says, like, for each school field trip, there will be a procedure identified? And then it could, like, reference your templated...
Oh, in the policy, you mean?
Like, in the policy, right? So it's like the school nurse is notified, part of the planning process, health needs and concerns identified and met for individual students and groups. A procedure for each school field trip will then be, identified as part of, it's something that says, like, and then each one will refer to their own context-specific.
I see. So somehow reference the procedural
plan.
Yeah, within the manual, or because we have a manual that all the nurses use, and that's where all the procedures
and then they can
would be.
Select. I'm sure the first graders going to the aquarium is going to be the same procedure each time, but then if students are going to Six Flags in another state, then that's going to be, it gives you the flexibility to create something new then too if you need to.
So Sarah, would after the black language after the word policy, there's one sentence there, just would it work to say, if you wanted to have this approved tonight, we can always come back next month and fine tune it if need be, but to say, the school nurse shall follow the procedures outlined in the school health manual?
Yeah,
Mhm.
Will that suffice to cover what
the field
Sophia is?
trip. Yeah, and I'm happy to come back. I mean, this wasn't what I thought would be my first one. It's just, we ended up with so many field trips with so many
Now in the
issues. And
spring,
then,
yeah.
well, it's the spring and, again,
Like field trips it is.
I feel like I'm like the, Fairfield County expert now too. I like did a presentation we have a meeting of nursing supervisors from all the different, which is really
I love
helpful,
that.
and I usually feel like the newest one in there, and I was like, no, in Massachusetts you can do this, in New York you can do that. So the school nurse shall follow the field trip procedure as outlined in the health manual.
Yeah.
Yeah, I think that's a good
That's good.
idea.
So then you would ask for, I believe Sarah's asking for a motion to approve the additional language that's in red and to remove the procedure language that's in red but struck out.
Yes.
So you're looking for a motion to
I'll
approve those?
Okay, we have a motion, is there a second? All in favor? Okay, any opposed? Any abstentions? Your policy carries.
Okay, thanks.
And
Thank
then
you.
you are-
As amended, as amended.
As amended,
As
yes.
Yeah. I need to read the Roberts rule. We have them. We have a book at home.
Oh, really?
Yeah, I really wanna go to the deep end.
Read the rules.
Yeah.
Thanks for going through that.
Yeah.
Yeah, I mean, it's that kind of an interesting process, because it sort of started with it actually started when my first staff meeting, a nurse made an offhanded comment, like, I really don't feel comfortable about this field trip going to Japan. And I was like, what are you talking about? Nurses have nothing to do with the field trips that go to other countries.
Right.
And then from there, I'm like, what do we have to do with the ones from states, and what do we have to do with the carrying medication, and so, yeah, it's been one thing that's gone into another, but thank you. Thank you
And
for
what
your
our practice is, what had happened, it sort of evolved over the years to where trying to be helpful turned into a lot of extra work for the nurses.
Yeah.
That work that they shouldn't have been doing, and so Sarah's doing a great job correcting these
Yeah.
practices and procedures and standards that are,
And I think it's
Out of
just
date.
sort of evolved as well. Like, the term field trip is used for any time you're taking a group of students someplace. And, yeah, and it's a very different thing, than what probably when the rules and the things were first outlined, and everybody was like, oh, this is what we do for field trips. Now our field trip is going to Tennessee, and
Even
now our
going out
field
of
trip
state is
Yeah.
like,
it becomes a whole other
Very different.
thing.
I didn't
And it's
realize.
super important to think about. I mean, if we're offering a trip to all kids and we have a kid with a medical condition who needs to go on it, we need to figure out how to accommodate that. It just,
Right.
takes a few
In
more
a safe
steps.
way, yeah.
Yeah, it just takes a few more steps to make sure we've safely followed all the rules. But thank you. Thanks for hearing me out on that one, guys.
Thanks for your work on it. Okay, any other new business?
we have none?
Okay, I'll entertain a motion to adjourn.
Motion to adjourn.
I'll second.
All right, any opposed? Seeing none, we are adjourned at 8:20. Thanks, everyone.
Thanks, everyone.
Thank you.